Hi, Psyche community. I'm Dr. Miranda Fisher, Medical Science Liaison at Otsuka Pharmaceutical, and I'm pleased to announce that I'm here today with Miss Laura Kaponer. Laura is a certified peer support specialist, a mental health advocate, and a social media blogger, and she is here today to provide a patient perspective on someone living with binge eating disorder. So thank you so much, Laura, for being here today.
Thank you for having me.
Yeah, so how does having a binge eating disorder diagnosis and struggling with food addiction, how has that impacted both your professional and your professional and personal life?
Well, what's interesting is it's actually the most prevalent eating disorder, but it's the most undiagnosed eating disorder. So the way it affected my personal life, I started with the eating disorder probably when I was around 9 years old. And all doctors kept telling me was, watch your eating and lose weight. But they didn't address that there was something psychological going on. I ran into a lot of health problems, a lot of emergency room visits when I would overeat. There were several times that I was at social engagements and I kind of passed out on the floor, crumbling in the fetal position. So it was a big hamper on my social life. Any event where there was a lot of food, I got really antsy. It was very triggering. I just couldn't control myself. I didn't learn other healthier coping mechanisms, such as, reaching out for supports or really understanding what I needed on an emotional level. I just let food fill that void. So food addiction is not too different from drug addiction, except that food is everywhere and it's legal. So you can't get away from it like you can with certain substances. It's always going to be there. Professionally, a lot of jobs have social events with food, like food days and stuff. And I can't ask my coworkers to not host those days. So there would be a buffet of tables and treats. And it was very hard for me to focus on what I was doing professionally that day at work, knowing that there were all these temptations, mere feet from my desk.
Yeah, and how has it impacted your overall recovery process?
It's tough because I think it's kind of like the chicken and egg scenario, like what happened first, my other mental disorders or the binge eating disorder. And I feel they, pun intended, kind of feed off of each other. Uh, with my borderline, a lot of borderlines are susceptible to addictions. And fortunately, I didn't end up having a substance use addiction, but it transpired with the food. It's harder to recognize that you have a problem because once again, it's food and it's everywhere, and people think you're just somebody who likes too many cookies. So the way it impacted my recovery was a lot of people not thinking it was a psychological issue and it was just like an impulse control issue that could be regulated with just diet. And I tried a lot of diet programs, and actually diet programs just make eating disorders even worse.
Yeah. So you're talking about, finally recognizing that there might be a problem and seeking help. What are some of the tools that you found that have been helpful to help manage your binge eating disorder?
The biggest tool was I had to advocate for myself because I kept trying to go to medical professionals, and just the medical industry in general is very biased against overweight and obese people. So when I tried to explain that I think I might have an eating disorder, I don't look like what people are used to thinking somebody with an eating disorder looks like because I'm larger and not smaller. So it was dismissed after so many years of my symptoms kind of being tossed aside and ignored by medical professionals. I had to decide to do research on my own. I thought I can't be the only one. And then last October, I was able to get into a residential treatment program. So after 30 years of an untreated eating disorder, I needed to relinquish all control and be in a 24/7 supervised situation, have my meals controlled, get deprogrammed from the diet industry, and learn the truth behind nutrition and nutritional therapy. And from that program, which I did for about 30 days, I went on to a 4-week virtual intensive outpatient program. And then when I graduated from that, I ended up seeing a nutritionist and an eating disorder specialized therapist. So finding out the proper resources and having professionals agree that you have an issue and them wanting to invest in helping you. What that led to is I am very particular about other medical professionals I see now, and if they are fat phobic, which is once again being discriminatory against people that are larger in size. And I had a provider recently that made derogatory comments about my size, and you have to stand up for yourself and know that that's not okay, and not be that person's patient anymore if they're not going to treat you with the dignity and respect that you deserve.
Right, absolutely. Well, I'm so glad that you were an advocate for yourself, and you went through and hunted out that treatment that you deserved. So thank you so much for your valuable perspective on living with a binge eating disorder. I think the audience will really appreciate it. And so just before we log off today, just a reminder to the audience to feel free to have a look around at our PsyQ website here, as well as the patient and caregiver corner. We're continually adding more content and resources. So thank you so much for listening.